Good morning, guys. As a GP and as a cosmetic doctor, I am very frequently treating acne. It is a really common condition, and I think it's really important that it's treated well because it affects people's self-confidence, firstly, and secondly, once you have moderate to severe acne that's leaving scarring is much more difficult to manage and treat. So it's better to be on the forefront and treating the acne before it's leading to scarring. Now, acne happens in people who have hormones, and we know that there is a genetic predisposition that some people are more sensitive to these hormones. So we know that it runs in families, acne. And the oil that's produced in the glands allows for a particular bacteria called P. acnes to propagate. So we've got oil production, we've got bacteria, and then finally that bacteria leads to an inflammatory process, which is what you see as redness or pus, a little bit of pain that happens inside the little spots. So there's really three things that we're targeting when we're looking at acne management: the oil or the hormones, the bacteria, and the inflammation. And so when we look at the management of acne, it really is targeting one or two or more of these areas that allows acne to happen. So for example, in general practice, particularly in women, one of the things that we can do quite successfully is augment the hormone production with something like the birth control pill or other medications that help to augment testosterone production in the skin. There are other things that also can be utilized to help with the bacteria, so antibiotics or antimicrobial agents that help to reduce bacterial growth on the skin, and these can be topical agents or oral agents. We can also utilize medications topically or orally that help to reduce oil production and augment the inflammatory process. For example, retinoids. What we call Roaccutane in Australia, or Accutane, or retinoic acid as an oral agent, is the gold standard for acne management for moderate to severe acne. Now, it is important in general practice, and I often will talk to my patients about how we have this stepwise approach. We don't put everybody who walks in the door with mild acne onto a retinoid, onto an oral retinoid. And this is because it is a risk-benefit assessment on side effects. However, moderate to severe acne, people who've got already signs of scarring, they've got a lot of inflammatory comedones on the skin, and particularly in areas that have got low oil gland production, if they've got signs of acne in those locations, I more quickly will suggest that that's something that they might need to go onto, and that they can do some research regarding that. So there you have it. There's my summary of the etiology of acne, and that's how we manage it in general practice or in cosmetics. And then of course we've got our friendly dermatologists who will manage the really difficult cases, particularly with prescription of oral retinoids.